Hey everyone, this is Ting O here, physical therapist at Physical Therapy Balance Centers. Thanks for joining us. Today will be number one of Physical Therapy's Hazelton's forum. So, joining us today, we have Megan Baran, physical therapist extraordinaire, and Anthony Damiano, physical therapist extraordinaire number two. Thanks for joining us. And so what we hope to do with this forum is just hopefully answer your questions about certain conditions that you may have. So what we did today was we scoured the internet, had a look at Google searches, and found out what the top searches that were out there for people for knee pain. So we're going to discuss some of the top searches out there. And plus, we looked on the internet and looked at some of the frequently asked questions that's out on the internet. Came up with some of the three top questions that people have asked, and hopefully we'll discuss that as well and share our expertise. So if you're joining us, follow along, and if there's anything else you'd like answered, post it down below in the comment section, and we'll try and discuss that and hopefully come up with an answer for you. So looking at the internet, obviously one of the biggest questions that gets asked is what causes knee pain? Right, so there's a lot of different causes for knee pain, and the main questions are what causes knee pain? Is it mostly arthritis? And what causes knee pain in the front and the back of the knee, which I guess a lot of people out there get pain in the back of the knee. Mm-hmm. So first of all, who'd like to answer the question about what actually causes knee pain?
Oh, that's a loaded question.
Yeah, I was just going to say it's a loaded question.
Yes.
So that's what our job is to figure out. Obviously we want to look at the whole person. We don't want to just look right at the knee joint. We have to go up and below the joint as well to figure out, why there might be some increased stress at the knee. It can actually be related to weakness in your hip. So, there's a lot of different muscle imbalances that can contribute to that.
So of the people that we see in the clinic with knee pain, what would you say were probably like the top three causes that we see in the clinic?
Well, number one off the bat would definitely be arthritis.
Right.
Probably the most commonly complained of problem that we have, especially in any patients over 55, 60 years of age. Mm-hmm. And then from there it gets kind of close. I would say patellofemoral pain syndrome would be kind of a number two, which is basically just an abnormality or mechanical problem happening at the kneecap. And then three, I would probably go with a meniscus damage of some sort, whether it be medial or lateral meniscus damage, whether it be anterior, posterior, front or back of the knee. That's probably number three.
Right. So why don't you, for the people out there that may not know, just describe a little bit about patellofemoral pain that you were describing.
Okay. So when you look at the knee, there's three main bones. You have your femur, your tibia below it, and then your patella, which sits, right in the middle. And that's a small bone that has no exact joint congruency. I can't talk.
That's a big word there, Doctor.
Yeah, I know. I'm trying to stretch my limits. Anyway, it's not a true joint, so it's kind of floating there. Is what I should have went with.
Right.
And if it's not controlled properly with either muscle activation and strength or with mechanics of the knee or hip or ankle, as Megan discussed, it could track poorly. It's supposed to stay inside a groove. If it does not stay inside that groove, it'll track, certain directions, most likely to the outside. Right. When you get that lateral tracking, you get some inflammation and rubbing underneath that kneecap. That happens too many times. You can cause damage to the cartilage under that kneecap, and people will complain of pain, mainly when they are bending, going downstairs, squatting, any of those motions.
Yeah, so from my experience in seeing our clients as well, I would say even if you have arthritis and other pains like from meniscal tears or tendonitis of any sort, they do eventually manifest into patellofemoral pain, because what happens is when you have these other injuries, your kneecap doesn't track properly because you get weaknesses and tightnesses, and if it doesn't track properly, then that kneecap problem develops, which on top of the other problems can make things more severe. Would you say That would be
Yeah,
fairly
yeah,
accurate,
definitely. Mhm.
Yeah.
So-
Saw the domino effect with
Right,
that
it's a
makes
domino
sense,
effect. So, and again, in my kind of experience, I would say that probably about 70% of the people that we see in the clinic would feel better with some sort of treatment to help with the patellofemoral tracking. Even though it may not fix the underlying problems such as arthritis or meniscal tears, it might help reduce the pain. And if we can help reduce the pain, it might make those other problems more manageable. So good job there,
Yeah.
Dr. Damiano.
I was just gonna say, going off of that too, if we can reduce the pain, you're, as, the patient is gonna be more likely able to maybe do some of the exercises that we
Right.
would want them to do that are gonna help that underlying problem.
Okay. So let's talk a little bit about meniscal tears then.
Okay.
So tell us about meniscal tears.
So your meniscus is a soft tissue structure that sits in your knee joint. It provides shock absorption, helps give the joint some cushion there. So sometimes, it's something that just breaks down over time with aging, like everything else in our body, wear and tear. Sometimes, though, it can be related to a specific moment of injury. So, if you're an athlete or somebody that does a lot of sports that involve rotational kind of
Right.
twisting stresses on that structure, that can break that down as well.
Right.
So when you don't have that cushion in the joint,
Mhm.
there's going to be more rubbing.
Right.
It's not going to be tracking like it should in the joint,
Right,
which is
right.
going to cause pain.
Pain as well, right. But the interesting thing is that from a lot of research that's done, there's a lot of people, meniscal tears typically only create pain when it's acute injury, right? So if you have a knee, if you're like in your 50s, you didn't recently twist your knee or you didn't do anything to do any damage to your knee, and you start getting pain in your knee, there's a really good chance that that's not going to come from your meniscus, because I don't know the exact numbers. You guys can help me out with this, but I believe it's over the age of 50. In people without knee pain, they found that about 80% of those people will have a meniscus tear just from normal degeneration.
Right.
So just remember, if you have the times that knee pain, that when a meniscus will create knee pain, is if it's an acute injury or if you suddenly twist it. And in those cases, that will create the knee pain.
Yeah,
Right.
yeah, and they're pretty easily rehabbed, or they respond well to rehab, is what I should say.
Right.
Especially when it's more on like that outer edge of the meniscus, which is more commonly where these tears happen,
Right.
because there's good blood supply, and when we know if there's good blood supply, there's good healing.
Right.
So most people do manage very well with conservative
Right,
treatment.
right. And there's an interesting studies out there that have shown that surgery for degenerative knee meniscal tears are not more effective than placebo surgery. So there's a good indication that conservative care or physical therapy can potentially help with that. Okay, so why don't we move on to the next question? So the next question obviously follows off the first one.
Yeah.
How do I get rid of knee pain? Which is the huge question, right? That's what people want to know out there. So again, a loaded question. So what do you guys think?
Well, I'll give you the simple explanation is we want to figure out what muscles in your body are tight. We want to loosen those. We want to figure out what muscles in your body are weak. We want to strengthen those. And if we can address, basically that area with, in terms of the exercise part of things,
Right.
That's going to improve the mechanics at the joint, allow for less stress there.
Right.
So that, from an exercise perspective, is how we want to address things.
Right.
But obviously, we have other treatment approaches as well.
Okay.
You had brought up the taping, so if you have someone whose patella is not tracking properly, we want to tape that up to try to teach them, as well as reduce some of the stress at that area,
Right.
to reduce pain levels.
Okay.
We also have different manual therapy techniques, so
Right.
there's a lot that goes into treating
Yes,
it.
yes,
but-
there is. So why don't we get into more specifics? Let's say someone has an arthritic condition out there with arthritis in their knees.
Okay.
What can that person do to treat their arthritis?
Well, I mean, first off, you need to find any mobility deficits in that person. Because a lot of people, when they deal with an arthritic joint, there's some immobility going on there because of the arthritis, and there's not good amount of fluid getting into that joint, allowing for proper lubrication and movement and whatnot. So first and foremost, we want to make sure that knee's moving well, but also make sure the hip's moving well, the ankle's moving well, and the opposite limb is moving well. I actually just read a study today that talked about hip mobilizations that we would do in improvements of patients with knee OA. And the study found that just with hip mobilizations, not even touching the knee, patients found some relief in pain in their knee joint. So, first off, we want to make sure we get proper joint mechanics and movement, I would say.
Right. So, no, that's a very, very good point, because I remember it's been a while since I've been to this conference, but what really stuck in my mind, this guy that was holding it was actually a high-level physical therapist that works with a lot of athletes. He had done studies that showed the stronger someone's quadricep muscle was, the less pain typically they're in. The more stable their knee was, the less pain they were in. And also the more flexible their knee was, the less pain they were in. So three very critical things. And but there's a lot of people out there that have a lot of pain in their knee. How do they get the strength and the flexibility when they can't really move their knee at this point? Where do they start? Where do people like that start?
Well, I would say, if you're able to, and you could get into a clinic, to see someone like a physical therapist, we do a lot of hands-on manual therapies, and we could assist in achieving proper motion and strength initially, and then once a person has some decrease in symptoms, we remove the painful stimulus, then we can really focus on their control of their strength and mobility and whatnot. But yeah, so I mean, if we can help initially hands-on wise, use our techniques, use our abilities, to get someone moving and out of pain, well then it just makes it so much easier for them to go and handle it on their own.
Right. Yeah.
And kind of going off of what Anthony was saying earlier, there's things that you can do for the knee that aren't even at the knee joint itself. So there might be muscles that are in your hip that are really, a main underlying cause for why you're having that knee pain. So it's not going to be something that stresses at the knee joint itself, but it would still help to improve your overall knee pain.
And I don't think we can overlook, a body weight. When it comes to knee and arthritis, it's always a touchy subject with people, but obesity is a problem, and it does lead to increased stress at the knee joint. I think for every pound someone's overweight, it's an extra 5 pounds of force added to the knee.
Right, 3, I think.
3, yeah, I knew it was something greater than
something like that.
Yeah,
but that is actually one of the other most commonly asked questions was, does weight affect knee pain?
Yes.
Yes. Yes. So unfortunately it does. But all right. So let's move on to another question. Injections. Should I get an injection?
So we definitely see a lot of patients that come in that have already gotten injections, and what I'll just say from my own experience with that is it can kind of be 50-50 with it. You see people,
typically what I find as well.
You see people that get the shot and they say, I feel so much better. Or you say, see people who get the shot that feel no different. Or maybe they only felt good for a day or two and then kind of back to square one with that. So, it might be a temporary fix, but it's not going to change the underlying problem that you have that's causing the stress at the knee in the first place. And what they're showing is that, repeated injections like that can actually be detrimental in terms of the tissues themselves. They can wear and tear into that as well. So it might be counterproductive in that way.
I've definitely seen those studies. There was one that was done over 2 years, where people that received injections over a period of time actually had more cartilage damage over that time period. So, so injections. No, yes.
Well,
not a great idea if you absolutely need one.
I think it all depends on what injection is it. Like, so most commonly we're talking a steroid injection. What does a steroid do?
Yep.
decreases inflammation,
Yep.
in that area that it, is injected into.
Mhm.
So maybe if you're getting this injection initially,
Mhm.
Injury happens, you see someone, injection is done.
Mhm.
That is, I'm fine with that.
Mhm.
Mainly because the injection is going to help decrease inflammation, which is what you want to do to an injury when it initially
But
happens.
not too much.
No, not too much. I'm just saying, right initially.
Uh-huh.
It's when it's done, 2, 3, 9 months after the fact
Mhm.
that it's, you're just decreasing inflammation. You're trying to decrease inflammation in a joint that may not even be necessarily inflamed. It could just be in pain, or it could be a chronic injury that,
Mhm. Right.
doesn't need it.
Right.
Yeah.
So, injections with care, with caution. Knee braces.
Okay.
Should people get knee braces?
That's another thing where I feel like, maybe some person might benefit, whereas another person, I don't necessarily think. If anything, it's going to, could potentially hinder your motion or, not allow you to build as much strength around the joint as well. We talked about someone who has patellar tracking issues. So in that case, maybe if that person is in a profession where they're on some hard surfaces, we know that they have the arthritis underlying, maybe they're just trying to prolong the time until they ultimately are looking at getting a replacement of the joint.
Right.
In that case, it might be a helpful tool just to, to help you get
Deload,
through your
yeah.
day, just to take the load off of the
Right.
knee itself.
Very good answer. Bracing, again, you gotta know the situation, you gotta know what your condition is.
I think it's best to
Potentially
get,
may be good.
yeah,
Yeah.
to get advice from someone like, a physical therapist, your PCP, your orthopedic, someone who, kind of has a good understanding of
Right.
anatomy, mechanics, things like that.
Right. Like us.
Yeah.
All right,
Yeah.
so final question. Heat or ice? Always get that
That is
question.
the tail oldest time.
Yes.
So,
Heat or ice?
in my opinion, the general thought is you want to ice if it's an initial injury, like you're trying to decrease inflammation and calm down any swelling or heat coming to the area, so it doesn't cause too much pressure in that joint or body part. Like injections. The steroid injection, same thing. You're trying to decrease inflammation. Taking NSAIDs, same thing. That's when an injury happens, that's what you kind of want to go for. At a certain point, ice and anti-inflammatory medications or whatnot is actually going to hinder healing because you are going to reduce blood flow to that area. And how do you heal without good blood flow? I mean, I mentioned about the meniscus. The outer 1/3 of the meniscus heals very well because there's good blood supply.
Right.
Well, if you're not allowing blood to get there, you're decreasing the amount of blood, well, you're not going to help the injury. So, long story short, if it's not within the first couple weeks of the injury, I'm probably not going to ice unless it's an acute exacerbation.
Right.
So, if an injury happens, hello? But anyway,
They're calling us, they want to come in.
Yes.
But yeah, so if an injury occurs and you get some ice on that initially, great. Just don't let it be a thing that you do a month, 2 months down the line.
Right. Unless you're Michael Jordan and just play a game of basketball.
Well, yeah, exactly. Yeah, and those are those acute exacerbations. Athletes do it all the time. Pitchers.
Right.
If you pitch a game, well, yeah, there's going to be maybe an acute inflammation going on. You want to calm that down. So
heat is okay then at those points.
I believe so. Once you could calm the inflammation down, I think it's better to transition to heat, get more blood flow to the tissue, help expedite that healing process.
Right. Cool. Very good answer. Anything to add to that?
I completely agree.
Okay. Cool. So, all right. So, those were the most commonly asked questions. So, theme that we get here is there's a lot of causes out there for knee pain. Arthritis being one of them, meniscal tears, patellofemoral tracking, or kneecap troubles, as Anthony says. So, the best way to get rid of knee pain is to know what caused it, right?
Yeah.
So if you don't know what caused it, it's very hard to treat it. And it's very hard to know whether you want to ice, it's very hard to know whether you want to brace, it's very hard to know whether you want to exercise or not. So key number one is find out what's causing the pain, and what's the best way to find out, would you say? Come see us.
I thought that's where you were going with this, but I wasn't sure. I didn't want to be wrong.
We are the experts
Yes.
in movement and identifying.
Yeah.
I
So
guess
especially,
weakness
especially if you can't get it out of the house in current times, feel free to give us a call, because we can talk a lot of through a lot of these things through the phone.
Yeah.
We can find out what's causing your pain, when it's being caused, and do our best to figure out what the pain is. And once we can figure that out, everything else gets easier, right? Would you say? And once you know what causes the pain, you can set a program together, and a lot of people will know over time. And exercise is the key.
Yep.
But if you can reduce the pain, like they were talking about, exercise is a lot easier, because when you have 10 out of 10 pain, I know I'm not going to be doing squats.
No.
So, all right. So, anything else to add about knee pain, guys?
I think, we really covered it all in terms of, especially, and I would say the questions that we found are, just again, from my own experience, a lot of times what you have patients asking as well. So.
Right.
Yeah, I mean, the only thing I would add, and we said it before, Megan said it a couple times, the greatest misconception we can have is that the area of pain is the source of the pain.
Right.
We have to look at the body as a whole entity, and kind of really assess what's going on. And I think that's what we're here for. That's why we're in this profession. That's why we went to school for so long and studied so hard.
7 years, huh?
Yeah, use the expertise. Yeah.
It's a long time. All right, so thanks guys for joining us. Hopefully we answered your questions today. If we didn't, pop it down, ask us in the comments section. We'll keep an eye on the comment section, and we'll try and answer, and we may even do some follow-up videos. So keep tuned on our channels, and this roundtable may be back.